I'd like to provide you with the information that we give on a periodic basis about the outbreak, our pandemic here in BC, who's being affected, and where, and some insight into where we're seeing cases being transmitted, and some of the data that we're using in public health to understand where we're going with this pandemic in our province. To start with, the geographic distribution of COVID-19 cases by health service delivery area of the case of residents. The residents of the case, so as you know, by convention, we classify people by where they live. That may not be where they were exposed to COVID-19, where people may be exposed at work or in social environments that are different from where they live. However, this is how we do it in Canada and here in British Columbia as well. So on the left-hand side, the cumulative total are cases from January 1st until November 5th. And then the blue graph on the right-hand side reflects the last 2 weeks between October 23rd to November 5th. And as you can see, the pandemic, as we know, has affected every area of the province, but has affected more the areas in the Fraser Health and Vancouver Coastal Health region, and particularly in the last 2 weeks, that is where we're seeing the intensity of the transmission in the province. The next graph is the geographic distribution by local health area. So this is a more granular local picture of where cases have been seen in British Columbia, and this is cumulative cases from January to the end of October. We first presented this information in September, and because we have smaller numbers at that smaller geographic area, we update this monthly, and so this is available publicly on the BC CDC website at the end of every month. And again, this gives you a sense of where the impact has been most across the province in a much smaller community and municipality level. And again, it reflects that the intensity of transmission really is concentrated, particularly in the last few weeks, in the Fraser and Vancouver Coastal Health region. The next slide provides our weekly profile of COVID-19 cases, and we have had the highest number of cases yet, with 3,121 new cases in the week that ended November 7th. Our median age has come down and stayed in the low to mid 30s. We've had 116 people who have been hospitalized this week. Our percent of cases hospitalized early on in this outbreak or in this pandemic were in the 20% range. It's now down around 6 to 7%. And the median age are people who are considerably older, in their 60s. We have had 7 new deaths in the past week. And 2% overall of people who have contracted COVID-19 have died. And we know that the age is one of the most important factors in terms of the probability that people will have severe illness or die from COVID-19. And the median age of those who have died from COVID-19 is 85. This is, again, our epidemic curve. So this is how we have, where we've seen cases by week since January, and our first wave, if you will, of this pandemic. As you can see, we flattened quite quickly, and it was focused mainly in areas around Vancouver Coastal Health. We now are seeing much more transmission, particularly in the last few weeks in the Fraser Health region, the most populous region in the province, but we have seen dramatic increases in transmission in that area as well as in Vancouver Coastal Health in the last few weeks. And if we look at this by likely source of transmission, so this is the data that we collect from public health with every single case to try and understand how this virus is spreading through our communities and who is at risk. And we are still managing to get most of that information in a relatively fast way. And the vast majority of cases that we can link to a local case or cluster. And I'm going to talk a little bit more about what that means and some of the stories, some of the data that we use to drive the decisions we've made about activities and orders that we have put in place here in British Columbia. I will say that with our rapid increase in numbers of people affected by COVID-19 in the last few weeks, this has been put at jeopardy. Our ability in public health to find everybody in a timely way, particularly in the Fraser Health and Vancouver coastal regions, has been stretched to the max, and we are falling a little bit behind, which is why we put in the measures that we put in, and I'll talk a bit more about that in a minute. If we look at the age group of people who've been affected by COVID-19 in BC, we can see that early on that purple line reflects people 80 years of age and older, and that is because our first part of our pandemic was driven by outbreaks in long-term care homes. More recently, through the summer, we started to see younger people more likely to be infected and to pass it on to others, and that's that dark green line that's at the top. We did have some decrease in that when we put in focus. We put in some orders and focused our activities prior to schools opening in the end of summer. However, recently we started to see young people again driving infection in the province, whether it's through social interactions primarily, whether it's through work interactions, and what we're seeing now is spillover into older age groups where people are more vulnerable. And particularly, we've seen in the last few weeks another dramatic increase in cases in people 80 years of age and older. And once again, we're starting to see spillover into long-term care homes where we know it's an older population that are more likely to have more severe illness. So to dig down a little more into what we're seeing, what exposure settings have made us concerned in public health, and why we are asking people to limit their social interactions, why we put in the orders we put in the last week. So this is just the information that we've gathered by exposure setting by age group since the beginning, middle of September when schools opened. As we have seen all along, the primary source where people are exposed is through their households or community interactions. So these are the social interactions we have, whether it's having people over to our house, having family meetings or family gatherings, whether it's having parties, celebrations, and whether it's in the community when we're connecting with people, our neighbors before our kids' soccer game. We've seen transmission where people have been going to the gym, for example, and all the right measures are being taken at the gym, but they're congregating before or after. We've seen it in hockey arenas. We've seen it at some youth football games. We've seen it with old-timers hockey leagues where the sport itself is fine, but it's the gathering together afterwards. And those are the household and community private party or events. When we put in measures to try and reduce some of the exposure potential in those areas we knew were risky, like at the banquet halls where we were seeing large numbers of people gathering, at nightclubs, which we have shut down, we've now started to see decreases in those areas. And right now, a lot of the focus of transmission in our communities, particularly in the Fraser Health and Vancouver coastal region, is because of our social interactions, whether it's in the community or at our home. And we don't put in place those same measures in our home to keep us safe that we do in other settings. The other thing this shows us is that young people, particularly school-age young people, have very few transmissions or exposure events that lead to cases from schools or daycares. And we do still see in the older age group it's related to healthcare, which again reflects transmission in our long-term care homes. So I want to talk just a minute about some of the other data that we have. So we collect information on people who are healthcare workers. What we don't have in detail, we collect this information, but not in a way that it's easy to pull out and report on, is where the exposures occurred for these healthcare workers. We do know that our healthcare worker rate has come down dramatically from early on when we were testing healthcare workers almost exclusively, and it's less than 10% right now of all of our cases are in people who are healthcare workers. The majority of them work as nurses or care aides, and that's not surprising given that's the highest proportion of workers in our that are in healthcare work. We do have, for example, a number of 83 dental professionals who were involved, and we know that the majority of those were people who acquired their infection attending a conference early on in the pandemic. And as you can see here, there's a variety of other healthcare workers who have been exposed. Most of the exposures are the same as the rest of us. We get exposed in our community through our family, for the people that we have contact with. And we will be providing more detailed data on that as we collect it. So I'm going to walk through a couple of real scenarios to give you an idea of what we're talking about when we say contact tracing, when we talk about what it is that leads to transmission in our communities, and the cascade that one infection can cause. So from just one positive COVID-19 employee in an industrial setting, 48 additional people became positive in that work site. One of those people was admitted to hospital. Seven other people became positive after interacting with one of those workers. 46 household contacts were affected. So people went home, and their household members had to be isolated. They couldn't go to work, they couldn't go to school because they were close contacts of a case. And there was 111 people who were unable to go anywhere for 2 weeks because of their exposure. Of the 7 people who had interactions with those 48 sick workers, 4 additional work sites were put at risk. One was a car dealership, where there is transmission to other staff at the car dealership. One was a medical clinic, a lumber mill, and a processing plant. And this just gives you a sense of one single workplace where somebody unintentionally brought the virus in with them, whether it's because they didn't recognize they had symptoms or they didn't feel they were able to stay home because of the nature of the work they were doing, can affect hundreds of others in our community. And this is how the virus transmits. This is another scenario, which is another one that we have seen happen far too often, particularly in the last few months. In this summer, when people started to feel like we were controlling the virus, we had a lot more social interactions. And this is what happened in one case, where 50 wedding guests were exposed. One person inadvertently brought the virus into a wedding. And yes, there was supposed to be a limit of 50, so 50 additional people were exposed. 15 of those 50 people became positive for COVID-19. And 10 of those people, additional households, where someone tested positive, requiring another 37 people to isolate at home for 2 weeks, not being able to go to work or to school. One person worked at a long-term care home, and an outbreak happened at that long-term care home that required 81 of the residents in that care home to self-isolate in their rooms for 14 days and to be tested and to not have visits from their essential family members. In addition, 3 people were admitted to hospital and 1 person died, tragically. 5 from those 15 guests who were positive, 1 family business was affected, and another 5 employees at that business were tested positive for COVID-19. And as you can see, it just takes one lapse that can have many multiple effects. And this is not just a single story. We have been tracing similar situations, whether it's from weddings, from birthday parties, from baby reveal parties, from celebrations of life. And these have happened all over the province. This is just one example. Finally, I want to talk about another scenario that we have seen repeatedly in small numbers. And so these are the scenarios that give us the sense of what are risky environments. So this was just one person positive at a fitness class. And from that one person, 67 cases at 2 fitness studios were infected with COVID-19. It led to 6 school exposures when family members or people who worked in the school inadvertently went to school at the time when they were potentially infectious to others. 4 people tested positive at a correctional facility, leading to challenges with staffing as 80 additional workers were required to self-isolate and unable to go to work. 3 people were admitted to hospital. 180 positive cases at 2 additional group fitness studios, and 37 more people tested positive after coming in contact with the initial 67 people. And of those, 7 tested positive after one person attended a games night. So this just gives you the impact. And it's not that businesses are bad or doing the wrong thing. We are learning from this virus that there are some situations that are much riskier than others. So doing group exercise indoors, and this is something we have come to appreciate with this virus over time, that indoor settings are more risky than outdoor settings. When you're exerting, when you're exercising and breathing heavily, that is more risky than when you're doing quiet exercises or quiet activities, and when you don't have physical distance between people. The other issues that we see are ventilation issues, indoors versus outdoors. And the fact that in many of these group activities, the music is very loud and there's somebody who's talking very loud to give you the instructions of what to do. And this can very rapidly spread this virus. We've heard about the challenges with aerosolization, and it's the environment that allows that type of spread to happen. And we've come to recognize that the safety plans that we thought were adequate for COVID-19 are not adequate now for this type of activity. And I say now for a couple of reasons. There are things that we could get away with in the summer. Probably because of the seasonality of this virus. We're learning that it doesn't spread as well when temperatures are warmer, when humidity is lower. But as we move into what we call our respiratory season, our cough and flu season, we're finding that this virus as well finds it easier to transmit. Partly because we're indoors more, but also because the weather conditions or the climate conditions make it easier for the virus to spread. And we're seeing that around the world. This is not unique to BC. We're seeing it across this country. We're seeing it in Europe, in all of the Northern Hemisphere, where it's becoming much more challenging. So things that we could do in the summer when we had lower rates of transmission in our community and the virus wasn't as readily able to spread, and we did a lot of things outdoors, we can't do now. We need to pay attention to the fact that we are learning more about this virus, and the safety measures we may have had in place before may not be adequate anymore. And what we're seeing in public health is that's what we are tracing people back to. So we're talking about several hundred people that cascaded out from several small group classes. So these made us realize that what we thought was adequate are not. And that's why we put the order in on the weekend to temporarily stop these classes. The other things that are happening in gyms are happening without transmitting of the virus. So those safety measures are working. But we need everybody to pay attention now, to go back and look at all of the safety measures, your COVID safety plan, whether you work in a food processing business, an office, a car dealership, or a gym. These are the times now to review those plans in the light of the increased transmission in our community and what we are learning about this virus as we go into this season. So what we know is that in the last 2 weeks, we had been seeing a steady increase, but we had been able to manage it. As I was mentioning, with public health contact tracing teams, we were doing a good job of finding people, stopping that next chain of transmission. In the last few weeks, that has become way more challenging, particularly in the Vancouver coastal and Fraser Health regions. And this is reflected again in a dramatic increase in our numbers of hospitalizations and people in ICU in the last 2 weeks. And what we know is that these hospitalizations are primarily focused in the Fraser Health and Vancouver coastal regions. In most of the other parts of the province, we are seeing increases in cases, but not at the level, and they're being able to be managed by public health. I want to put this slide up again because it also reflects important measures that we're looking at. You know, who are the people affected and what are the age groups? So what this shows us in the blue bars on the far right are the percent of the BC population in each age group. Next to that is the hospitalization, or sorry, the cases, the numbers of cases, the percents of cases in that age group. Then hospitalizations, ICU, and deaths. And what this shows us again is that under 12, under 10, we are underrepresented. So that even though our testing has increased in that age group, we're still not seeing very many cases in that age group. And the 10 to 19 year age group, we have seen an increase in cases. It's mostly clustered in the older, the 18, 19-year-olds who are more like the young adults. But thankfully, we have very few hospitalizations. We've had nobody who's required ICU care, and thankfully no deaths. Where we see the tragedy is later on. After age 70, the risk goes up dramatically, and most of our deaths have been in people who are in their 80s or 90s, our seniors and our elders. After looking at that, and talk a little bit about school cases, because this is something we've been watching very closely. Most school-age children with symptoms, again, continue not to have COVID-19, which is good news. We know there's been a lot of coughs and runny noses and a lot of children tested. The testing rates have increased 2.5 times since August, and now about 2/3 of the tests are done by the spit and gargle test, which is great. It's a lot easier on young people. And we're now up to about 1.7% of children test positive. So the vast majority still are not carrying COVID. And the school-age children are still less than 10% of our cases. This is just a numerical graph of the number of school exposures, and I just want to remind people that exposure is somebody being in the school environment during their infectious period. We have had very few transmissions within a school setting. So despite the fact that we've had 261 exposures where there's people, whether it's a student, a staff member, an educator in the school setting, that there have been less than a dozen incidences where there's been transmission within the school setting. And we've had one outbreak in a school in the interior health. So what that tells us is that the measures that we have in place, and particularly screening out people who are ill, catching them early, making sure that we're reducing the probability of transmissions in schools, is working. 9 in 10 schools have not had a school exposure event even across the province. And that is important. This has been a focus because we know how essential it is for our children to be in those environments and to try and make them for their education, for their growth, for their development, for their future. And I just want to say again how impressed I am and how important it is that teachers have risen to this occasion, that everybody in the school setting is doing their best to make sure that it continues to be a safe learning environment for all of our children. And these numbers tell us that we're doing a really good job at that. I'm just going to go quickly through some of the case rates. As you know, our rates have been increasing, and this is our daily cases per million population, our 7-day moving average, and it has increased in the last little while. And I notice in the newspapers they've noted that we've surpassed Ontario for the last couple of days. And you know, that is concerning. everything that I'm talking about has been because we started to see a dramatic increase, particularly in the last couple of weeks, and it's stretching our ability to cope from a public health perspective. But what we see is we're not alone in this. And with the exception of those areas who were very able to wall places off early, where where people moving back and forth is not as common, have been much better able to reduce the risk of transmissions. From an international perspective, here in BC and in Canada, we continue to do relatively well, both in our case rates and in people who have died from COVID-19. And I think that's an important measure as well, looking at what's happening. This is a global pandemic, and we are all learning, and we're all trying to manage what is happening in our own jurisdictions. And I'll put this again, this is cases and deaths in Canada and with BC. And as you can see, we have done a really good job at trying our best to protect those who are most vulnerable from this disease. But we are at a place that is challenging for us. And we don't want to be here now, but it is our reality, and it's one that we're dealing with along with everybody else around the globe. Our weekly summary of lab testing is up. We're up about 7% from last week, but our positivity has gone up, and that's a couple of things. One is we're testing more people, but we are also focusing on people with symptoms. And our positivity rate is now about 5.4%. Today it was just under 5%. And that is there's a couple of things with that. We worry about test positivity if we're testing large numbers of people and we're seeing high numbers of cases, but we're not, the positivity rates are lower. I'm not making myself clear, but what we're focused on is making sure that those people who need a test get a test, and our results are showing that that is working here in BC. Having said that, as we go further into respiratory season and we start to see more influenza, we're going to have to manage within our testing capacity, and that means slight changes to who gets a test or who needs a test for COVID-19. Right now, the proportion of our respiratory specimens, so this is the testing rates that we're doing by age group and by week, and the positivity, the percent positivity. And as you can see from this, in every age group, we are increasing our testing, with the exception of the older age groups, it's staying relatively steady. But what we are seeing is an increase in test positivity in each age group, meaning that we are seeing a higher proportion of our population being affected right now. And that is one of the reasons why we need to take a step back, particularly from our social interactions and from our travel. The next slide is an update on our Sero-prevalence study. So we started this in March. We did another slice of the population in May, and then this is from September. And what this is looking at how many people from community laboratory tests, the blood left over from tests by different age groups, have antibodies for COVID-19. So our seroprevalence is still about 1% here in British Columbia, which means we've done a good job at keeping it low in our province up until September. We're now into a second phase, and we need to take a step back and look at how we can manage to get us through this next few months. So this is our update on the modeling. As you know, we've been using the reproductive number, which is an average of how many people each case transmits to. It's a challenging number because we know that this virus is not transmitted equally by everybody. We know that there's settings, and I described a few of them, where one person can spread to many people. And then there's most people who don't spread to anybody. So it's a balancing of finding out how many clusters we have, and that's all put into the model. But right now, the bottom line is that we are above 1, which means that on average, people are spreading to more than one other person. And when you're above 1, that gives the potential for it to spread quite rapidly. I will note that when I last presented this information and before the Thanksgiving weekend, we had been dangerously above 1, and we had bent it back down again. Unfortunately, since that time, we've seen a takeoff in the virus in our communities, particularly in some parts of the province. And this is the first time we've broken it down, because we've had enough cases now in the province to be able to do this, to look at Vancouver Coastal, Fraser Health, and the rest of BC. And what we can tell is that the challenge is clearly in the Vancouver Coastal and Fraser Health areas. That's where our highest numbers of cases are, and that's where our modeling shows us that we are above that reproductive rate that we need to be at. But we are not out of the woods in the rest of the province. We have started to see, again, clusters and transmission, particularly people traveling back and forth from the Lower Mainland and from other provinces where transmission may be higher. So this is a cautionary tale to us. We need to start paying attention again to taking those measures that reduce the probability that we're going to spread this virus. Finally, there are dynamic compartmental models. These are ones, again, showing us where, how the progression of this pandemic is happening and potential scenarios for the future. We've added on this today, the doubling time. And what this shows us is our cases per day have doubled in the past few weeks, every 13 days. So that, again, is another measure that tells us we're accelerating the numbers of cases in our community, and we're having challenges breaking those chains of transmission through our case and contact tracing. As much as our staff are working every day and trying to get on those, we're reaching our limits. And that is why we need to take measures now to reduce those transmissions. If we look at it again, broken down by different areas of the province, we see most acutely in Fraser and Vancouver Coastal, but the gradual increase that we're seeing in other parts of this province is important as well. This is our time. We need to take a step back and recognize that we are being affected in the same way that people around the globe are being affected. The things that we could do in the summer when rates were low, when the climate was more favorable, we need to take a step back from now. It's not that people are bad or that businesses aren't doing the right thing. It's the things that we are learning about this virus is that it can now transmit very easily as we're moving indoors, as the weather is changing. And we need to pay attention to that, and we need to adjust and modify our behaviors to account for that. We need to protect those important things in our community, like our businesses, like our hospital and healthcare system, making sure that our healthcare is there for everybody who needs it, whether it's from COVID or from anything else. And we need to protect our schools. That is why we put in place the restrictions that we did this weekend and the week before that, reducing as a provincial health officer order around the province. What we are seeing is that it's our social interactions that we spread this virus inadvertently to those people we are closest to those people we socialize with, those people we have in our home or that we go outside, we go to parties with. And those are the people that we need to protect the most. And right now we're starting to see increase in hospitals, we're starting to see more people in long-term care being affected, and that's our signal. It's time to step back. We have to step back from our social interactions so that we can protect our community's health and wellness in the long term. We're learning that this virus, as I said, transmits much more easily inside. We need to get our social interactions back to those levels where our public health case and contact tracing can control the spread. That is in our hands to do. It's in our hands to keep our schools open, to keep our health system open. We are not trying to get this virus down to zero. We've come to understand that this is a virus that transmits in our community, and it's going to be with us for some time. It's going to be with us through this winter. And we need to find ways to live with it without putting people at risk, particularly our seniors and our elders. We need to put the brakes on COVID-19 transmission. We need to come back to making our wall strong so we can manage and control the spread instead of it controlling us. We are in a challenging time, perhaps the most challenging time of this pandemic. It seems to have been going on forever, but it will end. We do have hope. This is not forever. This week we've heard positive news about vaccines that will be coming available early in the new year, and we are planning every day to make sure that we can get those vaccines to people who need them as quickly as we possibly can. But it's not going to end suddenly. It's going to take us supporting each other for the next several months so that we can find ways to celebrate our past and protect our future, taking care of each other as we go through this winter. As vaccine becomes available, we'll be able to protect those who are most at risk, and that will allow us to do more. And then eventually we're going to have vaccine that's available for everybody, and that's going to happen next year. But for us to get from here to there, we need to all of us take a deep breath, recognize that we can do this, that we're all going to be supporting each other, that we have been through this, and we know more now than we did in the spring, so that fear and uncertainty, we can take a deep breath and put it behind us. We know what we need to do. We know it works. And now's our time to do it. We need to do it by standing together and staying apart, by supporting our communities, by helping out those we know, but doing it virtually. And we need, of course, to remember that we need to be kind to each other. This is not an easy time for any of us, but we will get through this. We'll get through this by being calm and being safe and being brave. Thank you.